So first we have Darren Mueller. He's an assistant professor and extension plant pathologist at Iowa State. Darren's responsibility include the management of soybean diseases. He is originally from Clinton, Wisconsin, and he earned his bachelor's degree in meat and animal science at the UW of Madison, and his master's and PhD in plant pathology from the University of Illinois. So welcome, Darren.
Thanks for the introduction. All right, so this talk is called Integrated Management of Sudden Death Syndrome on Soybean. And as an extension person, I usually sort of encourage questions and interruptions, but because this is being videotaped, I'll hold the questions till the end. So if you have any questions or something's not clear, please bring it up at the end. All right, so sudden death syndrome is probably not the #1 disease in Wisconsin, but it's certainly one of the diseases that you guys are going to see sort of on the rise. It's one that in Iowa we first saw in 1993, and since that time it has really established itself as probably the #1 disease, if not #2 behind soybean cyst nematode. So it's been a fairly important disease in Iowa, especially in pockets of Iowa. The symptoms are going to be the sort of the classic symptoms you see in any of the publications, that yellowing or death between the veins, and you usually see it in patches. Usually the leaves, if the disease progresses, the leaves will drop off and you'll still see petioles on that plant. However, it's a little bit of a misnomer. The sudden death syndrome name's a little bit of a misnomer because actually the disease starts right away in the season, and so the plant's actually infected probably all season long. You just don't see the foliar symptoms until later. And so the first phase of the disease is the root rot phase. And so the picture on your right-hand side, that plant on the right-hand side of that picture, it shows a really good depiction of what root rot looks like. And so this is caused by a pathogen called Fusarium virguliforme. The Fusaria pathogens in general, we call them root nibblers, which means that they're going to be attacking the lateral roots. They're sort of going to be reducing that root size overall. And so you can see that it's brown, it's rotted, it's a little bit smaller. That's sort of what that root rot phase looks like. Later in the season, you can be splitting the stems. In Iowa, you're sort of blessed or cursed with other diseases that look like sudden death syndrome. You have brown stem rot, you have some stem cankers that will cause fairly similar foliar diseases. White mold will cause that foliar symptom, at least briefly, if you get out there at the wrong time or the right time. And so it's really important for sudden death syndrome to actually slow down your vehicle enough to get out of it safely, and then wander into the field and pull a few plants and split that stem and look at it. And so the picture on your left-hand side, that's the sort of the browning in the vascular tissue. It's not in the pith like you'd see with brown stem rot. And so that's usually something you can see with a pathogen or a disease caused by Fusarium. You can also pull plants up at the end of the year if the fact that, unless you're a weightlifter, the fact that that plant easily pulls out of the ground is evidence that it might be sudden death syndrome, because there's a root rot phase. Brown stem rot's not going to have that. It's going to be a little bit tougher to pull up. Some of the plants that have a healthier root system, it'd be tougher to pull those plants up. If it pulls up easily, sometimes you can see that bluish growth on the outside of the plant. It doesn't happen all the time, but if you do see it, that's a sign that this is sudden death syndrome. All right, so in this talk, there's going to be several slides that use the term disease index. This is just a dorky plant pathology term that we use to combine incidence, the number of plants or the percentage of plants that are infected, and severity, sort of how sad those plants are. So, and then we put it on a scale of 0 to 100. So 100 being every single plant is extremely sad or dead, and 0 being everything is alive. And so, and then to put it into perspective, what does a DX of 10 mean? Usually on average, that equals about a 7% yield reduction when you're looking at sudden death syndrome. All right, so for management of SDS, it really starts with resistant varieties. And I'm not going to go over resistant varieties except to tell you that that's usually where you start. So if you have a field that has a history of SDS, the encouragement is to select a variety that is resistant to SDS. And the other thing is to start, is sort of an indicator disease. I say there's a couple of other indicator diseases out there that you might actually have a soybean cyst nematode problem as well. Usually when you have soybean cyst nematode, SDS is a little bit worse in those fields, or it might show up a little bit earlier. So If you do start seeing SDS, go out and soil sample and check your SDN levels and manage SDN using resistant varieties as well. So that's sort of the resistant side of things. So we are going to focus on seed treatments. This is a study that was done at Iowa State University where we grew plants at two different ages, and then we added inoculum. So we had the inoculum in that little fake beaker up there, and we poured it into each of those pots once the plants get a different age. And then we waited 18 or 38 days and looked at the root rot and the foliar symptoms. What we found was when we inoculated right at planting, the root rot phase, we almost had 100% severity in that root rot phase. And then if you look at all of the other planting days, day 4 to day 35, the root rot range was hovering right around that 50% of the plants being, or the roots being rotted. If you look at the foliar symptoms, you had a lot of disease at day 0 when it was inoculated at day 0, and absolutely no foliar symptoms for all the other ones. And so usually at this point I try to challenge people as to think about why that would be. There's too many people in the room, so I'm going to just hop right to the punchline. And so if you start looking at the cross-section of the root, and this is always the encouragement to actually pay attention in biology or to try to convince your kids or grandkids to pay attention in biology class, because this stuff might come back and haunt you later. But this is the cross-section or the anatomy of a root. And if you look at the outside, you have the epidermis. The sort of the big bulk of it is the cortex, and then there's the endodermis that is protecting the vascular tissue, which is in the center. And so if you saw Fusarium virguliforme, the pathogen that causes SDS, and inside the cortex, you would just have root rot. If that Fusarium virguliforme got past the endodermis into the vascular tissue, that is where you could also have root rot plus the second phase of the disease. So what happens is the root or the pathogen stays in the roots. It never really leaves the roots all season long, even when you see the foliar symptoms. It produces a toxin. That toxin gets translocated to the top, and that's what causes the foliar symptoms. And so if that pathogen stays in the cortex and it doesn't get into the vascular tissue, then it's sort of hanging out there in the roots and causing root rot. And so if this pathogen, although it causes a lot of damage, it's not really that aggressive of a pathogen as far as being able to grow internally. So a lot of times if that endodermis is a couple of days old or it's hardened off, it'll hit that endodermis and it won't try to grow through it. And so that root age and start looking at that root structure is really a critical thing. That long story is saying seed treatment should work. All right, and so the encouragement, so one of the things as sort of looking at the biology of this pathosystem is that seed treatments should do a pretty darn good job as far as managing this. If you rewind about 3 or 4 years ago and you start looking at all of the commercially available products that were out there, for anybody that is a graduate student or has written a thesis, this is always a really depressing slide because this is an entire thesis summarized on one slide. And really, the entire thing can be summarized in one bullet point is that nothing worked. And so, so you sort of have to stomach that. That might be sort of a roll of the dice as far as for the graduate students out there. But really, everything we evaluated, and we looked at a lot of different things. We looked at the quantitative PCR, looking at the amount of DNA in the roots. We looked at scanning every root and trying to see if there's any differences in the root structure. And really, everything came back as every commercially available product 3 or 4 years ago came back as not effective. So now fast forward to 2013, we started evaluating a product from Bayer Crop Science called Elevo. In 2015, another product called Myrtec from Syngenta became available that at least has SDS on its label. There are other products out there that are sort of less common. One's called Heads Up that also has SDS in the literature as far as it being effective. And so we being sort of a collective group of people from all of the states that are being mentioned on the slide, started evaluating these seed treatments, and I have data from each of these states, and so that's going to be shown over the next couple of slides. So this first one is in 2015 alone. This is the first year where we were able to evaluate things side by side, and so this is looking at Elevo, Myrtec, and Heads Up. On both resistant and susceptible varieties at 7 locations, 2 of them in Iowa, 2 in Ontario, Canada, and then 1 in Illinois, Indiana, and Michigan. And each of these products are being compared to a base seed treatment. And so Ilevo plus Pancho Votivo is being compared to that same group of products plus, or just Evergold Energy, et cetera. And then the Myrtec is being compared to the Syngenta base, and then the Heads Up is being compared to the Bayer base seed treatment. So if you look at the bars, each bar is going to be representing 14 data points, again, 7 locations, 2 varieties at each location. And the black bar is the percentage of disease reduction. And so you can see that the bigger the bar, the more disease is being reduced. And the red bar is the yield response. And so for Ilevo, the yield response was just under 4 bushels, was 3.8 across these 7 locations. And the reduction in disease was just a little bit more than 5 DX. And so, and then you look at Myrtec and Heads Up, we really were hovering right around 0 for both of these on average across the 7 locations. So, so I'm going to just focus the rest of it, or the next couple of slides, just on Ilevo alone. And so this is where all of the other states are coming in that are on that list. If you look at 2013, we had 60 observations total. 2014, 194, and then 2015, 210 observations. So the first cluster of graphs is the average disease. And so in 2013, we had just under 10 DX on average. In 2014, we had over 20 DX, and then in 2015, it fell in between those 2 years. For SDS reduction, on average, you're looking at, again, it's sort of flat. It's right around that 5 DX reduction when you're averaging it across all of the observations. And then for and then for the last one, the yield response, it really matches the amount of disease. And so 2013 had a yield response on average about 2.5, 2015 on average of about 5, and then, or 2014 an average of about 5, and then 2015, it fell in between those 2 years. So to break that down in a couple of different ways, if you look at the resistant versus susceptible varieties, and this would be my encouragement to anyone in the seed industry, is that there's not a lot of really good sources of resistance to SDS that are out there. There's certainly, it's improving each year, and my encouragement is to, as people are selecting varieties, is to if you have a field with SDS, is to continue to try to find the best variety that's out there. But there is not a big difference. And so when we're looking at susceptible versus moderately resistant or moderately susceptible line, on that scale of 1 to 9, you're looking at something between a 4 and a 5 or a 5 and a 6. And so there's not a big difference there. And that sort of is reflected here. There's not a huge difference when you start looking at resistant versus susceptible. But we do see a little bit more of a yield response when we have a variety that is labeled as susceptible. So the average yield response is a 4.2 when you have susceptible, and it's about a 3.2 when you have a moderate, some kind of level of resistance that's in there. Really, the biggest breakout is going to be looking at the levels of disease. And I'm coming from a plant pathologist. This shouldn't be a big surprise. But if you have, there's a couple of things to point out on this slide. The first one is if you have absolutely no disease, no foliar disease showing up, there's still, there's 53 observations that we had with this scenario, and we still had a 1.6 bushel yield response. And so in the seed treatment world, that's really not that bad. So the question would be, well, what's going on there? And so there's a couple of different thoughts. The first one would be there's just maybe the disease is hanging out in the cortex, and you just have the root rot phase, and so maybe there's some of the yield differences are looking at that root rot phase of the disease. The second one is sort of the reason they found this as Bayer found this as an SDS pathogen or a seed treatment is that it has nematicide properties, and so maybe there's something going on in that root system looking at the nematodes. So, and we really don't know. We have a graduate student that's looking at that. That's sort of some of the research that's going on is trying to sort of tease apart what's going on in that root system. So the next phase is sort of that 0 to 10, and I have it broken out in 2 different categories, but really if you have a disease index of 0 to 10, you're looking at yield responses in the 3.3 to 3.7. And just to put things in perspective, on that scale, that 1 to 9 scale that we use for severity, we usually do not start seeing defoliation until you get into the 20s and 25 to 30. And so this is still fairly low levels of disease. Now it's noticeable, you can see it, it's not bad, but we're not talking about patches of disease that you're walking out there that's sort of catastrophic and dropping leaves everywhere. So still fairly low levels, and you see that the yield response is around 3.5. And then if you get a DX over 10, you can see that that yield response goes up to almost 5.5. So the other thing to point out is, and this is something that we keep seeing, that there is sort of an upper limit to ILeVO. So if you look at the last two categories, the total disease or the average disease is 14.5 or 14.8, and that 10 to 20. And then the reduction was about 50%, so it dropped it down to 7.9. But then if you get into that last one, where the average DX was 47.5, there's not a 50% reduction in disease. And so you're looking at, there's sort of an upper limit. As you start to see more disease pressure, you do see disease. You're still going to see disease out there with ILeVO. And you can see that the yield response, there's a big difference in the amount of disease that's there, and that yield response sort of plateaus at that point. All right, so that's all the good news about ILeVO. There is the dark side of ILeVO, and this is, it does cause a lot of damage early in the season. So for anyone that is planting ILeVO or ILeVO-treated seed, this is something to keep an eye on. In 2015, we saw more damage than we had seen in all of the previous years that we evaluated it. And all of the people that looked at it for the first time, at least in Iowa, definitely noticed it, because my phone didn't stop ringing for about 3 weeks. So Bayer calls it a halo effect. I tend to stick with just phytotoxicity, because if you look at that picture on your left-hand side or on your right-hand side, that's not a halo effect. And so this is really a lot more than just a halo. So if you get out there at sort of the right growth stage to see this, you can see the entire field sort of looking brown and sort of having a pretty bad look or cast to that field. And so sort of keep that in mind. But I would say it was really good to see a lot of people going out and looking, because as a plant pathologist, there are other things that can cause early season damage, and it's good, it's sort of an awareness. It's just good to see it. I actually got more reports of Pythium seedling blight this year than I had previously gotten as well, because people were out looking. And this can cause very similar symptoms or very similar damage. There are also several different herbicides that can cause this as well. And really, when it becomes interesting is when you have a field that has maybe a little bit of Pythium, so somebody has applied a soil applied or pre-emerge herbicide, and you have a ILeVO-treated seed. And then you have to start sorting out what's causing what in this situation. So in 2014 and 15, we did a study where we're looking at the interactions between the pre-emerge herbicides and ILeVO-treated seed. This was done in Indiana with Kirsten Wise and Iowa, myself. And then we had a resistant susceptible variety at each location, and each one of these was treated or not treated with ILeVO. And then we tested several common pre-emerge herbicides, and we looked at phytotoxicity at V1 and V4, and then stand at V4. And really what we found was that there was damage caused by the seed treatment, there was damage caused by the pre-emerge herbicide, but there was no interaction. Meaning that if you had a scale of 1 to 10, and damage was a 2 with the seed treatment and a 2 with the herbicide, it didn't add up to 8. It added up to 4. And so there was no real interaction. And just like all the other studies, the ILeVO, there was no lasting effect on stand. There was no, and there was a positive effect with the herbicides, or with as far as reducing disease and increasing yield. All right, to summarize seed treatments, ILeVO does work. It worked better than the other products we evaluated. Yield responses were slightly higher in a susceptible variety, and definitely higher when you had disease index up above 10. All right, the last point I have is, as far as sort of an integrated management of SDS, is looking at cultural practices, and I'm only going to look at one. I'm going to pick on Iowa farmers because we did an evaluation, or we did a survey, and we asked them, and 96% came back and said they rotate to manage SDS in their state, and you can probably guess what the rotation is in Iowa. It's going to be corn. And so there's a problem with that, because if you rotate the corn, it doesn't work. And so if you have this study, we have a study where we're looking at the amount of times we can get Fusarium virguliforme isolated from different residues, and you can see that sort of the higher the bar, the happier it is in that different plant part. And the first two columns you have there, the corn residue was you could isolate Fusarium virguliforme from that as frequent as you could from the soybeans. And to sort of give you an idea or some perspective on that, this is a field study that was done. Started about 15 years ago in Iowa, and we've been evaluating it for the last 6 years. But this is in 2010. The picture on your right is where you have a lot of SDS in that 2-year rotation and not in the 3-year rotation. And so the 3-year rotation includes oats and red clover. The 4-year rotation has oats and alfalfa. And if you look at over time, the amount of SDS that's showing up in that field, where we have SDS showing up is less disease in the 3-year rotation and even more, and less disease even more so in the 4-year rotation. So why is that? We've been studying the heck out of these plots, trying to figure out what's going on in there. And it really comes down to the amount of inoculum, and it comes down to the amount of years that corn is present. And the more corn, the more inoculum you're going to have out there, and the more SDS you're going to have when it comes to soybeans. So with that, big thanks to all the people that contributed data to this presentation, also the checkoff for their funding, and also Bayer Crop Science. So with that,